Women's Health, Women's Health Week begins the week of Mother's Day, so I think it's a great time to be thinking about the ladies in our lives. Dr. Janis Coffin is a physician with Augusta University. She is a family medicine doctor, and she focuses on women's health. Dr. Coffin, I saw you a million years ago when I first started at Channel 6. I'm so happy to be back with you. Thanks for doing this.
Thank you for having me.
Let me just ask you the first question. In your practice, would you say it's an accurate statement that a lot of women don't pay as much attention to their health as they should? And if that's true, why is it?
So I think that's absolutely true. And I think the reason being is that women usually are the caretaker of the children. They usually take care of the house. If they're at home, they may be a homemaker, but they also may be the homemaker. They also may be working a full-time job and taking care of the children. They may have elderly parents that they're taking care of as well. So I think that women tend to look at other people and take care of them before they take care of themselves first.
Look, I know nobody's bulletproof, but can a woman, a young woman perhaps, get away with that for a while? And is there a point, if so when it catches up with you?
So I will say that yes, probably in our 20s we can get away with that,
Sure.
But really around 30 and thereafter we really have to be paying attention to what we're eating, how much we're exercising, and making sure that we're getting our annual physicals and screening for things that either the American Cancer Society or the American Heart Association recommends.
Let's walk through some of those things, starting with what we eat. How can a woman, especially a woman on the go, as you mentioned, eat healthily? Do you have to follow that food pyramid to the T? What's an easy, good way to make sure we're eating right?
So what I would say, it would be recommended that we all follow the food pyramid, but with everyone's very busy life schedule, sometimes that's hard to do. But what I would recommend is that if we can try to maintain a low cholesterol diet, trying to avoid a lot of fatty foods in our diet, that is extremely helpful, as well as avoiding a lot of caffeinated or beverages that have a lot of sugar intake in them. So if we can just avoid a lot of the sugar intake and as well as avoid a lot of fatty foods, that in and of itself would be helpful.
What's a drink or a food that we have way too much of?
So here in the South, people tend to drink a lot of sweet tea, and what people don't realize is the amount of sugar that is in sweet tea.
A ton.
A ton. So what I would recommend is if you can do unsweet tea and either put a sweetener in there or just half the sugar, that would help tremendously.
And it doesn't mean you can never have it. It just means when you do, be careful.
Or yes, and do it. Everything is in moderation. So I tell people if they're going to go and they're going to go out to eat, if they get a piece of cake, cut the cake in half. You can have that half and then maybe the next day have the other half.
What you're saying is impossible. I'm kidding. No, it's tough though.
It is hard.
It
yes.
is hard to leave that second half of the cake, but you're right. Your body just craves that sweet taste. It doesn't necessarily crave the whole piece, right?
That's exactly right. So if everyone can just do things in moderation, whether it be with their Coca-Cola product or their dessert product, but if they can do it in moderation and cut it in half and do the other half the next day, it does help tremendously with cholesterol and with blood sugars.
Let's take a look at exercise. This is typically the time of year when most of the New Year's resolutions have worn off because people try to do too much too soon. How can we get started on an exercise plan, and what kind of exercise is good?
So what I would say is the American Heart Association recommends that we all do about 30 to 40 minutes of exercise at least 4 times a week. Now that's anything getting your heart rate above 80%. So what you want to do is either fast walking, jogging, riding a bike, but you have to get your heart rate above the normal level for at least 30 minutes. And I tell people if they're not exercising, you don't want to go out and do 30 minutes at a time. What you want to do is maybe 5 minutes every week and build up by 5 minutes until you reach a goal of 30 to 40 minutes every week. And you want to do that at least 4 times a week.
You know, it's good for women, obviously, and men, but we're talking about women to get their blood pressure checked. How can we maintain a healthy blood pressure in between visits to you?
So what I recommend is that if patients are on blood pressure medication, that they check their blood pressure at least once a week. For those people who don't have blood pressure problems, when they're at the grocery store, at the pharmacy, to sit down and have their blood pressure taken at least maybe once a month just to see what it's running. And goal would be that blood pressure would be less than 140/90.
140/90?
Yes, sir.
If you are genetically predisposed to having high blood pressure. Is it possible through the diet and exercise tips you've mentioned to kind of outrun your genes?
Yes, it is. So main thing is if you have a predisposition for having high blood pressure, either your parents have it or family members do, not only should you eat a low cholesterol diet, but you want to try to watch the amount of salt that you put in your diet. So packaged foods, potato chips, TV dinners, those have a lot of salt intake in them. So what you want to do is if you can either use a salt substitute like Mrs. Dash, or try to avoid the table salt. You can salt it a little bit while you're cooking, but then at the dinner table you want to avoid the salt shaker.
Dr. Coffin, we've done a lot of stories here on News Channel 6 about cervical cancer. What do you tell your patients when it comes to getting screened for cervical cancer, and what's kind of a good age for ladies to start thinking about that?
So really the American Cancer Society recommends that we start screening women at age 21, and then they should have a yearly pap smear up until age 30. If those pap smears have been normal, then they can go every 3 years, but it shouldn't be any longer than that. So every year from age 21 to 30, and then if those are normal, after age 30, they can go every 3 years.
Breast cancer. I know that's also an important issue to so many people watching right now. Do we still like mammograms? Is that the best way to go? And give me an age and a frequency on that.
So there's the guidelines have recently changed. So the American Cancer Society now states that if you don't have a family history of breast cancer, they do recommend screening now between age 40 to 45, and then get a mammogram every year while you're healthy. The thing is, too, you want to try to do monthly self-breast exams as well, because a lot of women tend to pick up or feel something that was not there before, and then they go in to see their physician, and then they can get a mammogram done that may or may not pick up something. But yes, we do recommend mammograms. It is a good way to screen, and 1 in 8 women will get breast cancer, is what the statistics show.
I don't hear a ton about osteoporosis anymore. Is that still a concern, and how would you direct your patients concerning the health of their bones?
So what I would say is, now that Americans are living longer, osteoporosis is one of the biggest things that we need to worry about in anyone really over the age of 65. So the recommendations are that whether you're male or female, starting at age 65, you should get a bone density screen or a DEXA scan to see if you have any evidence of osteoporosis. And the way to prevent that is, number one, to do regular cardiovascular exercise. You don't want to be sedentary, and you want to make sure that you're taking at least 1,000 to 1,500 milligrams of calcium a day. So a glass of milk or a bowl of cottage cheese constitutes 300 milligrams. So you need at least 4 to 5 servings of dairy every day. If you're not doing that, you can supplement it with either like a calcium supplement over the counter.
What about immunizations? I know as we get older, it seems like we get fewer shots, certainly not as many as we did when we were little children. What do you recommend for women about immunizations and making sure that those are current?
So what I would state is that there's statistics that show that people under the age of 18, about 95% of people are properly immunized, but only about 5 to 10% of the population over age 18 is properly immunized. So I do recommend that over the age of 18 that everyone get at least a one-time dose of Tdap, which is tetanus with the acellular pertussis, because there's been breaks out of the whooping cough throughout the United States. If you are a smoker, you do qualify for the pneumococcal vaccine, which is the pneumonia vaccine. If you're not a smoker, then what they recommend is that starting at age 65, you get the pneumonia vaccine. And then there's the new varicella or the Zostavax vaccine for people who've been exposed or had chicken pox to prevent shingles later on in life.
Probably my last question, and it's just to ask you about depression. How can the women who go to their physicians or the other people in those ladies' lives make sure that we spot the warning signs of depression? Give us some advice on that front.
So studies actually state that about 25 to 30% of all Americans exhibit some symptoms of depression. And so we say SIGI caps. So if you have any if you're sleeping too much or too little, you have loss of interest in the activities or hobbies that you were doing, you feel guilty about things that you never feel guilty about, you have a lack of energy, lack of concentration, either your appetite has decreased or your appetite has markedly increased, or if you're having any suicidal or homicidal thoughts, those are all symptoms of depression. And if you're exhibiting any of those symptoms, I would recommend that you call and see your primary care physician.
That's a conversation in a lot of cases where the patient needs to bring it up with their doctor, correct? You're not going to spot that in a physical.
No, sir. So, you know, anymore, a lot of practices are patient-centered medical homes, so there should be an active, ongoing conversation with you and the patient, not just the physician talking, but the patient also needs to come in and voice their concerns so that there can be an active conversation, and from that conversation then develop an active plan.
Listen, a ton of advice in about 11 minutes time. I really appreciate you. I know a lot of women watching have been helped today. Dr. Coffin, thanks.
Thank you so much for having me.
Absolutely. Dr. Janis Coffin, go see her. Go see your family physician. Ladies, get checked out. Run down that checklist that Dr. Coffin just did for us. You'll be better for it.